This segment of the Plastic Surgery channel is brought to you by Galatea, now offering Galaform, the first 3D mesh for soft tissue support.
No Spin Live, here we go. We've got a great program for you today. We're going to talk about some topics. Number 1, the hip dip. Number 2, breast implant ALCL, facial filler blindness, the president, Donald Trump, and cosmetic surgery, and the designer nipple. It's going to be a great show. We've got 3 world experts in plastic surgery joining us to give us some great insights. Jason Posner from Boca Raton, Florida, Charlie Mesa from Weston, Florida, and Stephen Camp from Fort Worth, Texas. How are we doing, boys?
Very good. How are you?
Doing great, Bill.
The hip dip. Why women should celebrate this latest body trend. Jason.
We call it violin deformity. You know, it's a shape. It's a depression above your outer thighs and sort of a bulge by your hips, and it looks like a violin. So the women are, in this article, we're calling this the hip dip, and that it's a good thing. And, you know, look, women, men come in different shapes and sizes, and our ideal has always been for sort of a smooth hip to outer thigh transition. But if women like their little larger outer thighs or hips, you know, that's fine with them. But I can tell you from a practical standpoint, most of the patients are coming to me to fix those sort of depressions and highlights.
Steve, I mean, what do you think? Is this a trend, or is this just some misconception?
No, you know, I think it's kind of a pocket, kind of a niche trend, if you will. The great thing in plastic surgery is that we actually have patients that we talk to that are people. It's not like veterinary medicine where we kind of look at our patients and they don't make any noise when we talk to them. So we can ask them, hey, you know, does this depression bother you? And if we listen to the patients well enough, we can get a good sense for what their aesthetic is, because we're not really trying to transfer our opinions onto their result. We're trying to understand what the patient's trying to derive out of plastic surgery.
Charlie, what's your take on this?
I think that people like to give catch terms or phrases to areas of the body they're trying to improve or procedures to increase awareness of it. But I think I agree with what's been said already is the bottom line is they want to improve that area of the buttock, hip, and thigh. But as been stated, plastic surgery is unique and everybody is unique. So it's beauty is in the eye of the beholder. So you really have to deliver what the patient's looking for. That's what's most important.
One other thing with this, no one has ever come into my office asking to create a hip dip. Okay, they've only come in to kind of reduce this area. So we'll see. Maybe this will lead to some different changes.
All right, well, let's go. I want to jump into a topic that's not new to No Spin Live or certainly the Plastic Surgery channel, but I think it's something that patients hear about, breast implant, ALCL. And the more we learn about this, particularly through research and things, it's kind of the more misinformation that we see comes out to patients. So are patients getting alarming or false information from these publications?
Well, I definitely think that there's a watchdog mentality on some of these articles that you see presented. And I do think it's misleading in that regard. I do think that the article at times lumps different categories of problems together under one umbrella that can make patients feel that the implants are the culprit for whatever their problems or conditions might be. So some of the data seems incomplete to me. It's very one-sided.
Based on the current data, and we're talking about in 30 million women with breast implants, there's never been a case of breast implant ALCL with a smooth only implant, which is for a lot of women really important because your risk of it is 0 if you have a smooth implant, at least right now.
Every implant is not designed for every patient. You have an individual patient, individual problems, and the appropriate implant selection is very important.
Oh, looks like we have a new addition to the program. It's a bird, it's a plane. No, it's Dan Delvecchio from Boston, Mass, but it looks like he's in the car, so hopefully he can talk to us. Dan Delvecchio, should we be using textured implants given the information?
I think that there are patients who are willing to accept the risk, and I think there are really important attributes for textured implants, and I think there are patients who won't accept the risks. So I think the important thing is to just outline the risks And the way I understand it, it's like 1 in 6,000 for one manufacturer and 1 in 60,000 for another. So if a patient's willing to take that risk and it's outweighed by the benefits of the textured device, the lower bowl, the lack of lateral drift that we see sometimes, then I think it's a good implant. But I think the patient needs to know the risk.
The craziest part of these articles, particularly the one from Philadelphia, is that there's this kind of William Faulkner-esque stream of consciousness from breast implant and ALCL to how breast implants caused autoimmune diseases and it's never been proven, which I thought was really bizarre. I just want to get you guys' take on this. I thought that was one of the most misleading things for patients because, Steve, I thought that whole thing had been put to rest scientifically years ago.
Yeah, I agree. This has been studied in multiple different article settings and not just within the plastic surgery community. So, we've got different position statements from different groups that have looked at this and found no definitive relationship. And that's really why they're safe to use. Whereas the other things, the autoimmune disorders, those have been pretty well studied with high volumes of patients. And most experts agree that there's no scientific evidence linking them.
Jason Posner, there's been 35 high-level scientific articles that have never seen any link of silicone breast implants and autoimmune diseases. But is that enough? Now do we have to go back and revisit this?
The problem is, quite clearly, the data is there that there's no link between autoimmune diseases and breast implants. That's well proven at this point. All of us are going to agree to that. We've read all the data is clear. But we have this wild, wild west device called the internet, and people search on there and they think that their thyroid disease that's screwed up is from their implants. And then we have a few doctors in our specialty whose whole practices are linked to taking out breast capsules and implants to cure these women of whatever disease that they don't have, and they're perpetuating this myth. So we're our own worst specialists, because if you look on our colleagues' websites, there are whole information about how their autoimmune disease is going to get better.
This is from it's from the Australian Society. This is not something new, but it's an important piece of information about soft tissue fillers and that there's been cases of blindness that have occurred. And what can you tell us about that and what do patients need to know?
The key is when you get a filler into some of the arteries around the eyes, you can get blind. So the key is, in experienced hands, can this happen? Yes. Is this a high risk? No. Around the eyes is need a more experienced injector. I would definitely not go to someone advertising on Groupon to get your filler around the eyes. Go to someone experienced, go to someone who knows what they're doing, and that doctor should go slow and inject carefully.
What insights do you have, Steve?
Well, I totally agree with his comments. It's like that Geico commercial in reverse. You save 15% on your car insurance, but not 15% on your face. And so you do need to have somebody with expertise to do that. Everything we do in plastic surgery has some degree of risk, but there's principles and things that we can do to keep our patients safe.
DDV, any comments on this one?
Every day we insert needles or cannulas in people and inject, steroids, fillers, fat into nasal turbinates, scalps, faces, buttocks, breasts, and there are risks. And frankly, I'll say this. I think it's a great, great technique, but I'm surprised it doesn't happen more often, Bill.
Charlie, you have any final comments?
The only comment is that I think it's more important that we stress using the blunt, micro cannula injection for fillers anywhere in the face, because the blindness can occur from injections anywhere if it's done intravascularly.
I think that's good information, stuff patients I think we'll learn a lot from. All right, let's get into a little more lighthearted topic. There's this Twitter battle going on between this Morning Joe host on an MSNBC program and the president, Donald Trump. Trump apparently said the one woman, Mika Brzezinski, had a bad facelift, basically. What's up with that? What's the President Trump and cosmetic surgery? What do you think?
I don't really buy any specific bias or tilt against cosmetic surgery or plastic surgery in a global scope by his comments. I really think he's just trying to direct a schoolyard jab at somebody who's upset him for their views on a political commentary type show.
Yeah, the mainstream media loves to pick up on this, but Charlie, I mean, is this like Steve said, is this just a schoolyard jab?
This is just Donald Trump being Donald Trump. Plastic surgery, cosmetic surgery is a very acceptable thing to have aesthetic surgery of the face of the body. So he was just trying to be mean and belittle the person he was directing it at, as opposed to saying something intelligent.
I think the actual thing was he said something about bleeding from a facelift. You know what? Tweets are one thing. His views towards cosmetic surgery are another thing. You know, he's done a lot of tweets. I'm not going to comment on the tweets. I'll comment, though, that President Trump has had a long history of being around beautiful women and being involved with beauty pageants. He has a good aesthetic eye, I'm sure. His wife is beautiful. His daughter is beautiful. So, I don't think he has anything negative to say about plastic surgery. I think the tweets had nothing to do with our specialty or what we do. It had to do, again, with a political commentary. So I think we should leave it at that and move on to the next subject.
So moving on, we talked about designer vaginas earlier in the show. And now we got this story on designer nipples. So, I mean, come on, man. Is this like a marketing scheme or something, Steve? I mean, what's the deal?
Well, I think maybe. I don't really have a problem with it, but I think that we're making too much of an issue of these kind of specific procedures, which many of us do in conjunction with our breast augmentation or other breast procedures. I think it's just a little bit too much hype for something that we do every day.
Jason, are you doing a lot of designer nipples in Boca Raton?
You know what's funny? I read this article that you sent us about these designer nipples and this doctor who sees 18 patients a day for nipple correction. I mean, you got to be kidding me. It's something that we do on a routine basis. I see inverted nipples. I do the same thing he does. I like to pierce them. I think it works really well to stretch the nipples. Although last week I did have the weirdest request I've ever had in my life. Patient wanted heart-shaped nipples, a heart-shaped areola. But I haven't really seen any uptick in business or shape changes to the nipples or areola based on these trends.
Charlie, is this, like I said, is this just like somebody trying to market something that everybody does, or is this guy truly the world's global nipple expert?
Well, in his own mind, he may be, but I think you're right. He's just trying to create a niche. Like everyone said so far, we all do inverted nipple repairs, nipple reductions, and a realer surgery. So it's all about giving the patient an aesthetic look that's more pleasing to them, and it's more aware because of the revealing clothes, because of the internet, because of magazines.
You're from Boston, Dan. I mean, like designer nipples. Tell us about that.
Nipples big, nipples small, heart-shaped nipples, diamond nipples. I agree with all the speakers. This guy's just trying to find a niche, and there is no niche for him. There is no nipple niche for him.
All right, well, listen, I think those are some awesome insights. People are going to enjoy that. And if you want to see more of this, you can get it at theplasticsurgerychannel.com.